hurt my finger training Brazilian Jiu-Jitsu. I snapped my tendon from the finger and sort of came down into my hand. That was the initial injury that I had when I came in and saw Dr. Ehab. He was really understanding. He was very proactive. He managed my expectations very well in terms of what I was looking at, how long I was going to have to wait until I could do sports again, especially wrestle again. Then once we went into surgery, I went into surgery feeling very confident that I was in the right hands. He really is someone that could empathize with what I was feeling. He gave me a very good explanation of what was going on and what the surgery would entail. Then after the surgery, I had to go and do rehab with him and with Dr. Samira Kutz. They both worked as a team and they communicated very well along the way to make sure that my recovery was very fast and very smooth, which indeed it was. They were both very good. I have to emphasize at communicating and letting me know what the next steps would be, what was expected of me during the initial recovery time, what the time frame would be. And I have to say, I believe we were ahead of schedule. I did hear them say that they hadn't seen someone recover that quickly in a very long time, which again I would attribute to the advice and the knowledge they shared with me on what to do and when to do it and how to do it. So all in all, I'm very happy. I'm very grateful and very glad that I landed on their hands and that they both took care of me. They really did a great job. I cannot thank them enough because I do understand that it is their job, but at the end of the day, it is my life. And I got my pretty much 90% of my finger mobility back. I'm back at training jiu-jitsu and wrestling and doing all the things that I like doing. My life is pretty much back to normal.
Andreas presented to my clinic a few days after he sustained an injury to his finger. This happens while he was playing sport. It's called a Jersy finger because it's happened mostly for players who they play rugby, basketball, or any sort of contact sport. And the injury, it includes detachment of the tendon from the bone itself. So the patient loses the function in the finger. So after having the consultation with me, we did an X-ray and ultrasound, we confirmed the diagnosis, and then I went and explained to the patient exactly the steps that we're going to take for reattaching the tendon into the bone. We used a new technique by making a very strong repair to the tendon so that we can start the physiotherapy to prevent any stiffness. And this is one of the reasons that he had an excellent result afterwards, because we managed to start the physiotherapy immediately after the surgery. And I think he's extremely happy with the result afterwards.
I'm also very grateful for all the staff here at the King's College Hospital. Everyone from the admin team all the way through the nurses were extremely good, extremely patient, very kind. They helped me with all my needs, from printing out all the invoices I needed in order to send them to my insurance company, all the way to email communication and handing out results. I know that especially Dr. Samira was pretty much booked out in advance for about 2 weeks, and I spoke with one of the admin people at reception, and they went out of their way to make sure that I could get booked in with her to do all that. So I'm very grateful for that, because that really shows that the hospital cares about my health and they really cared about my recovery. They really went out of their way to make sure that all my needs were met, that everything I needed was available. And again, I'm thankful for that.